So again, thanks, Susan, for getting us off to a great start, and Neil. What we're going to do now is have some kind of lightning round conversations at the tables around two kind of important questions that are on your agenda. So again, just as backdrop, as Neil and Susan alluded to earlier, accreditation has come up, I think, at every workshop I've been at. And it usually comes out in the form like, if they just put this as a standard, that would really help. Or if accreditation would just stop doing that, so that would really help. And so I think now's an opportunity at the tables to really dive into a couple of those questions that's come up repeatedly in our past work together. So what we're going to do is give you about 10 minutes at your tables for the first question. Then we'll do a bit of a quick group debrief, gather some thoughts, and we'll collect your ideas. Then we'll go into the second question, then have a large group debrief again, and kind of close out before we take a break at, I believe, 10:45. So here's the first question that we want you to spend the next 10 minutes talking about. Will requiring attention to a topic through accreditation actually improve the quality of education in that area? And if you have time, and if so, why? Okay, so spend 10 minutes at your tables, have somebody collect the thoughts at the table if you could, and then we'll have a little bit of a debrief here in 10 minutes, okay? By the way, if there's anybody in the overflow room, please feel free to continue the same type of conversation and then send somebody in if you have some thoughts you'd like to share with the large group. Thanks, Patricia. Okay, let's go ahead and regroup. So this is going to be a little bit like speed dating. We have about 7 minutes just to collect some thoughts from your tables to share with the large group. So who would like to start? Just kind of your reflections on this first question. I'm sorry to interrupt your conversation. I know this is difficult. Any thoughts on this first question? I'm close as I can. I'll do this. Any thoughts on the first question? Yeah, please. Zora.
Sorry, Zori Talib from George Washington University. So we had, I'd say, a vibrant discussion. We picked a couple of examples. We picked first social determinants of health and then looked at actually interprofessional education as both examples and talked through it. I think what we came up with, and I hope I'm paraphrasing well, is that it requires three things as we looked at that question. In order to couple the attention to a topic with quality, requires first a clear vision that everybody sort of agrees on. It requires a clear definition of what attention means so that you avoid the checklist. And it requires quality, to really improve quality would require a clear definition of outcomes. And so that's something perhaps is even measurable.
Terrific. Other thoughts? Yeah, please. Yeah.
We came up with Miguel Paniagua from the National Board. We had a similar discussion, and we did use interprofessional education as one of the frames to discuss this. And the answer to this question is, it depends. It's possible, and it's quite likely. And again, I'll try to summarize and only add to what Zori said, which is that wouldn't it be lovely if accreditors could work together and get off and move past our professional identities to work on something like interprofessional education? If it's not competency-based, then maybe these types of requirements are left to interpretation, and then how does that affect quality? But of course, the more prescriptive we are as accreditors, then we're not allowing the individual identities of institutions to shine. So where do you strike a balance?
Great. Thank you. Yeah, please. Table 5.
I'm Katie Elliott with the Academy of Nutrition and Dietetics, representing Table 5, and I think we maybe asked more questions than we actually came up with answers, and also coming up with the it depends, but just some additional thoughts that we had is, speaking of quality, the need to actually educate the educators, bringing it all the way down to, how we're actually going to define that and with our educators, but also, assurance versus quality. I mean, what does this really meaning to these programs and to these professions? We also came up with prescription versus innovation, and not wanting to limit our programs. And then what does this actually look like for our patients, other constituents? So I'm just adding to that conversation.
Great. Yeah, Table 7. Yeah, it's on.
Okay. Sarah Fletcher, Physician Assistant Education Association, representing Table 7. So we talked about the kind of it depends, but it was stated as it could, but not necessarily. So we felt like that attention does provide focus and hopefully would help find some exemplars of quality. There had to be a focus on the topic, the process, the examples, outcomes, and measurement of quality. But there'd also have to be a focus on the instructional methods. So in other words, how any topic was introduced and delivered. That also leads us to talk about the resources that would need to be required. So for example, we focused on the issue of the clinical sites or preceptor shortage. And a conversation that took place last night posed the question, could any healthcare provider serve as a preceptor for any other health professional? And that's just something to toss out. If you think about a topic being introduced, being sure that we have the right landscape and the right resources to introduce it.
Great. Anybody else? I'm sorry, over here. And then Holly.
Thank you. Darlene Curley, Jonas Fund. And our discussion was very similar. One slight difference was that requiring attention to a topic, we thought that was just step one. Like that is the beginning. That has to happen first. But the improving the quality really depended on the implementation of it. And something needed to be added to that. And it was more of the, again, the outcome. Like what is the outcome for the patients, the clients, you know, the community that is receiving that. So it's a good beginning, but it's just the beginning.
Great. Holly.
Holly Wise representing Table 1, which we started out with it depends, like most everybody in the room, but we ended up with yes, but frustratingly slow. And our topic really focused a lot on the diagram, and we focused on the content or a topic that was on the right-hand edges of that circle of accreditation, of the moving forward but not operationalized. And then we digressed a little bit to say that were those arrows actually converging or diverging? And then it made it even slower when it was thinking of broader topics. But we also ended up with wondering whose responsibility was it for operationalizing the topic of interest? And is it the accreditors to demand it of the professions that are giving the input? Or is it something that evolves from the profession? And to make sure that we included the practitioners in this discussion and not just be solely academicians providing the input.
Yeah, how many people have heard this before? Unfunded mandate? All right. Let's move on to